Hi, so welcome all to the episode 4. So today we will be discussing about the ABO discrepancies and how to proceed with the samples which show ABO discrepancy. So we have learned that during ABO grouping we need to perform a forward group and a reverse grouping. So both the forward and the reverse grouping should be in line with each other and complement each other. So in situations where there is a mismatch between the forward and the reverse grouping, then a discrepancy arises. So today I have Dr. Anand, who is a resident at our hospital, and he will be guiding as to how to resolve the discrepancies by the cold enhancement technique as well as at 37 degrees. So we will be discussing using two case scenarios, and over to you, Dr. Anand. Thank you.
Now we have a case-based example for resolving an ABO discrepancy using cold enhancement. We have a 65-year-old male patient recently diagnosed with CLL, chronic lymphocytic leukemia, and we have received a sample for pre-transfusion ABO typing. There is no known history of any blood transfusion and there is no drug history also. These are the requirements that we need for testing. For forward grouping, we have tubes for anti-A, anti-B, anti-AB, anti-D, and as control we have taken 6% albumin to analyze if there is any RBC isoagglutination. For reverse grouping we have tubes for A cell, B cell, and also O cell and auto control. These are the pooled A cell and B cells. This is the patient RBC and patient serum. There is a 3% RBC suspension we had made. This is the control 6% albumin. These are the commercially available anti-A, anti-B, anti-AB, and anti-D solutions. Now we are proceeding to the testing as per AABB guidelines. Here we are adding 1 drop of anti-A to the corresponding labeled tube in forward grouping, 1 drop of anti-B followed by 1 drop of anti-AB and also 1 drop of anti-D to the corresponding labeled tubes. And at last in forward grouping, as we have mentioned, we are adding 1 drop of 6% albumin also as a control. Now we are adding one drop each of 3% red cell suspension of the patient to all the tubes of forward grouping. Now coming to reverse grouping, this is the patient serum. We are adding 1 drop each of patient serum to A cell, B cell, O cell and auto control tube. This is the pooled A cell at 3 to 5% concentration. We are also adding 1 drop of pooled A cell to the reverse grouping tube, 1 drop of pooled B cell to the corresponding tube, another drop of pooled O cell at 3% concentration to the corresponding tube, and in the tube of auto control we are adding 1 drop of patient's own RBC to dictate if there are any cold or warm auto antibodies. Now we are going to gently shake the tubes and mix the contents of the tubes of both forward and reverse grouping. We will ensure that all the contents are mixed very well, and after that we are going to incubate the tubes for 30 minutes at room temperature. After incubation in room temperature for 30 minutes, we are transferring all the tubes for centrifugation. The tubes should be placed properly in the appropriate slots. We must also ensure that the weight is balanced in the corresponding opposite slots to get a proper centrifugation and a proper result. We are rotating the rotor to ensure that the weight is balanced properly, and after that the centrifugation has to be done as per the standard operative protocol of your institution. Now coming to analysis after incubation in room temperature followed by centrifugation. First we will be seeing the tubes of forward grouping. In anti-A we can see that there is a strong 4 plus agglutination reaction. In anti-B, while gently shaking the tube we can see there is no agglutination reaction in anti-B. In anti-AB also there is a strong 4 plus agglutination. In anti-D there is a strong 4 plus agglutination reaction. In the control tube of 6% albumin there is no reaction. From these tubes in the forward grouping we can infer that the probable blood group of the patient will be A positive. Coming to reverse grouping tubes, as we can see there is no reaction in A cell tube. In B cell there is no agglutination reaction. As we expected the group to be A positive from forward grouping, we expected to have a reaction B cell, but there was no reaction in B cell. O cell also there is no agglutination. Autocontrol tube also there is no agglutination. Here we can see that there is no agglutination reaction in all the 4 reverse grouping tubes, hence the group of A positive cannot be confirmed. This is the side-by-side analysis of the results that we have obtained after incubation and centrifugation at room temperature. In forward grouping, we can clearly see a strong 4 plus agglutination reaction in anti-A, anti-AB and anti-D, suggesting A positive blood group. Whereas in reverse grouping, there are no reaction in all the 4 tubes. Hence, we cannot confirm the blood group as A positive from reverse grouping. This might be possibly due to a weak or a missing antibody. In order to find the weak or missing antibody, we will be proceeding to further testing, that is the cold temperature enhancement. For that, we will be asking for a fresh sample of the patient, and we will be also taking a detailed history which includes history of any recent or past blood transfusions, any transplantation history and drug history also. After receiving a fresh patient sample, we will be repeating the previously done test at room temperature, and further we will be proceeding to incubation at 4 degrees Celsius at the next step. As per AABB guidelines, we will be incubating the tubes of both forward and reverse typing at 4 degrees Celsius for 15 to 30 minutes. After incubation at 4 degrees Celsius for 15 to 30 minutes, we will be proceeding with centrifugation. Centrifugation has to be done as per the standard operative protocol of the institution. After the centrifugation, we are going to analyze the results that we have obtained. We can see that first proceeding with the forward grouping tubes, there is a strong 4 plus reaction in anti-A. There is no reaction in anti-B. In anti-AB also there is a strong 4 plus agglutination. Anti-D also there is a strong 4 plus reaction. In the control tube of 6% albumin there is no reaction. Coming to reverse grouping, there is no reaction in A cell. In B cell, after gently shaking, we can see that a 1 plus agglutination reaction has been developed in the B cell, which was not initially there at room temperature. Coming to O cell, there is no agglutination in O cell, and there is no agglutination in autocontrol tube also. This is the results we have obtained after incubation at 4 degrees Celsius. We can see a 1 plus reaction that has developed in B cell. This is the side-by-side analysis of the results that we have obtained after cold enhancement testing. We can see that there's a strong 4 plus agglutination reaction anti-A, anti-B and anti-D in forward grouping, pointing towards A positive blood group, and in reverse grouping we can see a 1 plus agglutination reaction in B cell, which was initially not there in testing at room temperature. This point outs to a weak anti-B antibody which was not initially detected, and later on get enhanced on cold enhancement testing, and it got detected now. Now we will be moving on to another case-based example for resolving ABO discrepancy due to an unknown extra antibody. Here we have a 60-year-old male patient recently diagnosed with coronary artery disease, and the patient has been admitted to undergo coronary angiography. The sample was received for pre-transfusion ABO grouping. On obtaining history, there was no history of any PRC transfusion, and there is no known drug history also. Now we will be proceeding with the testings initially at room temperature, as we have mentioned before. We have mixed the contents in the respective tubes, and we have kept it for incubation for 15 to 30 minutes, followed by centrifugation also. And now we will be analyzing the results we have obtained. Here we can see that in forward grouping, in the tube of anti-A, there is no reaction. In anti-B, there is a clear-cut 4 plus agglutination reaction. In the tube of anti-AB also, there is a 4 plus agglutination reaction. And next, coming to the tube of anti-D, here also we can see a 4 plus agglutination reaction. And the control tube of 6% albumin, there is no agglutination reaction. From the forward grouping, we can assume that the blood group of the patient should be B positive. Coming to reverse grouping, in A cell, we can say that there is a strong 4 plus agglutination reaction. In B cell, on generally shaking the tubes, we can see that there is a 2 plus agglutination. Since the blood group we found on forward grouping was B positive, we didn't expect to have any reaction on the B cell, but here we are getting a B plus 2 plus reaction in the B cell. Coming to O cell also, we are getting a 2 plus agglutination reaction, and autocontrol tube is also having a 2 plus agglutination reaction. These are the results we have obtained after reverse grouping in room temperature. We can see that in A cell there is a 4 plus strong agglutination reaction. In B cell also there is a 2 plus reaction, which should be possibly due to an extra antibody. In O cell also we are getting a 2 plus reaction pointing out to an unknown cold antibody. In autocontrol also we are having a 2 plus reaction, which should be possibly due to a cold auto antibody. Hence, to resolve this, we will be proceeding to further testings at 37 degrees Celsius. Here we are transferring all the tubes of both forward and reverse grouping to an incubator, and we will be incubating them at 37 degrees Celsius for a duration of 15 to 30 minutes. Following incubation at 37 degree, we will be proceeding to centrifugation, and after the centrifugation, now we are going to analyze the results we have obtained. Coming to forward grouping, in the tube of anti-A, on gently shaking the tube, there is no agglutination reaction in anti-A. In anti-B, there is a strong 4 plus agglutination. In the tube of anti-AB also there is a strong 4 plus agglutination. Coming to anti-D, here also we can see a strong 4 plus agglutination reaction. Coming to the tube of 6% control albumin tube, there is no agglutination here. Now we will be proceeding with the reverse grouping tubes. In A cell, we can see that the 4 plus reaction is there. In B cell, we had a 2 plus reaction at room temperature. Now the agglutination has been resolved. There is a negative reaction in B cell. In O cell also there is no reaction. And the tube of autocontrol, here also there is no agglutination. These are the results we have obtained after incubation at 37 degree followed by centrifugation. In reverse typing, we can see that in A cell there is a 4 plus reaction with negative reactions in remaining B cell, O cell and autocontrol. Hence we can see that the ABO discrepancy was resolved after incubation at 37 degree followed by centrifugation.
Thank you, Anand. That was a very wonderful description and a presentation. So you have covered all the steps appropriately and explained it in detail. So before we move ahead with the discussion on the ABO discrepancies, I would like to ask, are there any other factors like the technical errors or any other parameters you take into consideration before proceeding ahead with the resolution of the discrepancy?
Thank you for the question, ma'am. Before proceeding to further testing, we should rule out the common technical errors that result in ABO discrepancies. It includes inadequate identification of blood specimens, tubes and slates. The cell suspension prepared may be too heavy or too light. There can be a mixing up of the samples also, missed observation of hemolysis. There may be a failure to add reagents, failure to add adequate samples. There may be a failure to follow the manufacturer's proper instructions. The centrifuge may be under-calibrated, or there can be even an over-centrifugation or under-centrifugation also. And finally, the reagents and the blood samples we are using may be contaminated. All these common errors should be ruled out before proceeding to further testings.
Thank you. So that's a long list of errors which can be encountered. In fact, they are practically encountered on a day-to-day basis, and it is very important to rule out these errors before we proceed to resolve the discrepancies. Now coming to the ABO discrepancies, can you please elaborate what are the types of ABO discrepancies and how they are classified?
Yes, ma'am. Broadly speaking, the ABO grouping discrepancies can be grouped into 4 types, of which type 1 is the most common one. Type 1 is due to missing or weak antibody, and it is usually detected during reverse grouping, whereas type 2 is due to a weak or missing antigen, and it is seen during forward grouping, while the type 3 is due to protein or plasma abnormalities and also due to Rayleigh formation. And finally, the type 4 are the miscellaneous causes which are seen unexpected due to cold auto or allo antibodies and also due to chimerism.
So we have discussed the type 1 and the type 4 discrepancies, and the type 1 was related to the missing antibody and the type 4 was due to a presence of cold antibody. So can you please elaborate what can be the causes for the type 1 discrepancies and the type 4 discrepancies, and under what conditions these are seen?
Thank you for the question, ma'am. The cause of group 1 discrepancy is due to weak or missing ABO antibodies. It is usually seen in newborns and elderly, patients with leukemia, lymphoma, patients on immunosuppressive therapy, patients with congenital or acquired agammaglobulinemia, patients who have undergone bone marrow or stem cell transplantation, patients whose existing ABO antibodies were diluted either due to plasma exchange or due to plasma transfusion, or patients with ABO subgroups. Coming to the cause of group 4 discrepancies, it is usually due to cold auto or allo antibodies. It can be also due to circulating RBCs of more than one ABO group in those patients who have received a PRC transfusion. It can be also due to unexpected ABO isoagglutination and also due to unexpected non-ABO allo antibodies.
Well, that was insightful. So it shows that a history taking, knowing the age, knowing the gender, knowing the past medical history, the transfusion, transplant history, all these factors contribute towards the resolving a discrepancy. It gives us a clue as to what underlying factor might cause the discrepancy. So could you also explain about how the cold enhancement works or what is the principle of action behind it? Similarly, how does 37-degree incubation helps in resolving a discrepancy due to presence of cold autoantibody?
Yes, ma'am. As we know, the group 1 discrepancy is due to missing antibodies, while the blood group antibodies are IgM type antibodies, which are more active at lower temperatures than at room temperature. Thus, cold incubation helps to enhance the antigen antibody binding and also increase the visibility of agglutination. Slower reaction kinetics at lower temperatures also allows the weak antibodies to bind more effectively to these low density antigens. While coming to that of the group 4 discrepancy, which are mainly due to cold antibodies, incubating these antibodies at 37 degrees Celsius help to eliminate the cold unwanted antibodies that are clinically irrelevant.
Thank you for the description, Anand. So, are there any precautions you take or we need to keep in mind while we are performing these procedures like the cold enhancement or 37-degree incubation? Does any factor influence the outcome? Would you like to elaborate a bit on it?
Yes, ma'am. We do take multiple precautions while running all these tests because most probably there can be chances of false positive due to cold auto or allo antibodies during the testing. Which can be prevented by running an auto control and an O cell control. There can be chances of a non-specific agglutination for which we have to wash the cells thoroughly to remove the plasma proteins before starting the testing, and also we have to compare the reports and the results we have obtained with the non-subgroup patterns and the patient history before giving the final reports also.
Yeah, thank you. So, very important point to note is the use of O cells in reverse grouping and to always run an auto control. So, these two precautions are immensely important, and sometimes the role of these two tests are undermined, but they are of vital importance while you are proceeding to resolve the discrepancies. Thank you, Anand, for the detailed description and the demonstration of all the procedures. With that, we come to an end of episode 4, and we will be discussing all the other methods which are used for resolving the discrepancies like the enzyme technique, the adsorption elution methods in the subsequent videos. But for now, if you have any queries related to the procedures shown today, you may please drop in your queries in the comment section and we'll answer them back. Thank you.